Moving right along, let's talk about how information enters and exits the brain. There's only one way in and out of our brain, and that's through a big hole in the bottom of our skull called the foramen magnum. Through here exits our 12 cranial nerves, as well as a large tract of nervous tissue called the spinal cord, or spinal column. Let's start with the cranial nerves. So there's 12 cranial nerves, which take information directly from the brain and send it out to the tissues, or vice versa, depending on the nerve. Each nerve has a different function, and when we're assessing patients, we can look for deficits in certain areas to see if the cranial nerves are working properly. Here's a really cool example. So a stroke is called a cerebral vascular accident, and it occurs when a part of the brain doesn't get enough oxygen. Usually it's from a bleed or a blood clot that kind of floats up and blocks one of the arteries. The common signs of a stroke are fast, facial droop, arm drift, slurred speech, and when you see them, it's time to go. When you see any of these, you need to get the patient to the hospital right away. It could mean the difference between somebody having slight numbness in their hands or permanent disability or even death. This is the interesting part. One of the cranial nerves, called the facial nerve, when it gets damaged, also causes facial paralysis. You might have heard of Bell's palsy. So as healthcare practitioners, there are some tests that we can do to try and figure out, is our patient having a stroke and is it a life-threatening emergency, or is this just some type of facial palsy? It's pretty cool. Here's a list of the 12 cranial nerves, and the expectation is that you know their name, the number of the nerve, and a general sense of what the nerve does. Remember, each nerve has a set defined number, so cranial nerve 1 is the olfactory nerve. It's really important that we memorize these. So leaving the brain is that tract of nerves called the spinal column, all wrapped up in the same meninges that cover the brain: the dura mater, arachnoid mater, and pia mater. The spinal column itself is made up of white and gray matter. Gray on the inside, white on the outside. The gray matter is made of interneurons in the cell bodies of motor neurons, whereas the white matter is fully myelinated neurons that carry information up and down the spinal column. Sections of the white matter are divided into tracts. It's a similar kind of concept to nerves that carry particular type of information in a certain direction. For example, the extrapyramidal tract sends information to the muscles regarding balance and muscle tone, whereas the spinal thalamic tract tells the brain about sensations of touch and pressure. So coming off the spinal cord are a series of spinal nerves, which come out between the vertebrae in our spine and send information to different parts of the body. There are a number of spinal nerves, and they all line up with the different regions of the spine. There's 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, 5 sacral nerves, and 1 coccygeal nerve. These nerves send information to certain areas of the body, and these areas are called dermatomes. This is another example of how we can use anatomy to help diagnose injury. So for example, the nerves from C8 send and receive information up the back of your arm and to your pinky and ring finger. So as a healthcare provider, whether that's OTA, PTA, a nurse, medic, whatever, if a patient tells you they can't feel their pinky and their ring finger, there's a good chance that they've pinched or damaged the nerves that come out of the spine at C8. All right, so a recap of the nervous system. Information is transferred from sense organs all over the body. They go to peripheral nerves, and then eventually they end up in the spinal nerves, where it travels to the spinal column and then potentially up to the brain. From there, information is transferred from sense organs from all over the body. They go to peripheral nerves and then eventually to the spinal nerves, where it travels all the way up the spinal column and then potentially to the brain, where a response is formed and sent back through the same channels. I said potentially on purpose, because there are times when the body can't or won't wait for the information to get to the brain before it thinks it should react. So sit in your chair, bend your knee at 90 degrees, and just let it hang off the ground a little bit. Now take something solid like a phone or a book and just tap the tendon that goes across your knee. If you hit it in just the right spot, your knee will straighten out. That's called a reflex. So physiologically, what's happening here is that when you hit your knee, the tendon is stretching. If you stretch it far enough and fast enough, the receptors in your knee send information to your spinal cord, letting them know that there's a problem. If you don't move the knee, the tendon could get hurt. That information goes right to a motor neuron in your spine, which then immediately causes your quadriceps to tighten, extending your knee. The brain was never involved in this process. The reason that we check the reflexes, or they get checked when you see a healthcare professional, is that it's a great way to see if the spinal nerves and the spinal cord is damaged and where. The example that I just gave you guys with the knee is called a 2-neuron arc. There are some more complicated reflexes that use 3 neurons, so a sensory neuron, an interneuron in the spinal cord, and then a motor neuron that moves the muscle.